Hi again. This is part 2 of the Q&A video. Actually, I had some problems because my mom came doing noise. But I think it's better actually that I post it in two videos, so you don't get lost. You can watch it in two different times, and it's better. So I keep going now with the questions I did to my surgeon, and that I think that can help you a little bit. My last question was the last thing I covered in the first part of this video, was about the skin excess that you could suffer from, mostly in class 3 cases, because they normally push backward the jaw, but in my clinic, as I just explained, they normally push forward the upper jaw. So in this case, it's not gonna provoke, or it's not gonna cause this. Next question, it was about is my face gonna look shorter, going to solve my long face syndrome, my chin will look shorter, and so on. Of course, I had concerns about my long face syndrome, and yes, this is now I can tell, even though I'm still swollen, that my face looks shorter. My face, my mom, when she just saw me after the surgery, she was like, "Your face looks shorter." So yes, and yeah, it looks like less vertical now, but it's not gonna be like, okay, you're gonna go from long face syndrome to round face. No, I actually spoke to another patient, and she had long face syndrome as well, and she told me, this is your expectations. I thought like, oh, now I'm gonna have a totally different face. Now they're gonna still be you. They're gonna get it shorter where they can, or they can do genoplasty or so on, but you are going to still be you. It's not gonna change dramatically. So do I have less long face syndrome? Yes, but I don't have a round face now. And next thing, how many weeks of sickness absence will I need? Normally, if you have to speak a lot or whatever, they tell you around 1 month. I know people who they work on the computer and they don't have to speak. Sorry for the noises that I make with my saliva. But if you don't have to speak a lot, or I tell you, like, these patients, they work on their computer and that's it. They went back to work after only 2 weeks, so it depends a lot on your job. In my case, I have many meetings with enterprises, or I have to talk a lot and so on, so I cannot go back to work. This is gonna be 1 month of sickness absence, and maybe I have to extend it for 1 or 2 weeks more. I don't know, my doctor will tell, but it really depends. But normal basis, 1 month is the regular time. Also, how long will the recovery take, and when will I be able to exercise? I already told about the exercise. And about being perfect, I tell you. So looking normal, like comfortably normal, like, okay, you don't look very swollen, it's gonna be 2-3 months until you go out and you are not shouting that you had a surgery with your face. And so I have still 1-2 months to go. Then I know people, like, they are in the 6th month and they are starting to feel more comfortable, but they still have a lot of swelling, and there are days in which they wake up like very swollen. So it really depends. But to see the final results is 1 year or a little bit more. So just sit down and chill. Next, should I prefer or buy something like for the surgery? Headband, ice mask, many things like this. So, well, I tell you, I only bought 3 things. It was a band like for the ice, like to hold it here. Also a bottle to drink, like with a very tiny, thing to put it in your mouth. And also this jade roller. And the only thing I used, it was this. Because the ice, they told me that after the first 2 days to stop using completely ice, because it can actually slow down the healing process and get this harder a little bit, and we don't want this. We want this to you have to move and so on, and this has to go down naturally. But if you put ice after the second day, it's gonna be worse even. So I've seen on internet, on YouTube, many people who say like, second, third week, I still use ice. They told me that to not do so. They told me in the clinic, just that. So I didn't use it. So I want to clarify that. And also about the bottle, like with the special thing to put it in your mouth, with barely opening it. In my case, because I didn't have my mouth shut, and they advise you as well, like to start drinking from a glass and normally, and start like having normal movements, or even to put the spoon in your mouth the faster you can. So I didn't use it either, because the first day I used a syringe, and then the second day when in the hospital, in the clinic, when the nurse came, she was like, no, this is going to the bin now, let's start drinking from the glass. And I was like, no way I do that. I put my mouth like this. The first glass, everything went down onto my jumper or my thingy, but the second glass, I learned how to put my mouth, and I drank it. So it's better, like you don't need, they tell you to not buy many things. It's good to buy protein, like in powder, because you're gonna have lack. You can lose some weight, you can have some lack of proteins because you're not having meat or more solid things. So definitely this helped me to put this powder, this protein on, on yogurt or on juices or on things like that. But that was said. And also to not drink acid drinks, like not orange juice. I already told you in the past video, because it can make that the stitches go down faster because of the pH. So no juices or no acid drinks. But apart from this, there was nothing special like to buy. This was all like to eat very well, the water peak if you don't have it, this, but that's it, guys. Then when will I have to come back to get the screws removed? So I will go in 2 weeks to Barcelona, and I don't know when will they remove these screws. And they told me that the plates and the other screws, they won't, if everything goes fine, they won't remove them. But I will let you know when they remove these ones, these guys. Other thing, when will be the next control session after this one? I think it's one is half of a year, but I will let you know as well. And is it convenient to have Invisalign afterwards, or better braces? they didn't say anything for this. Like, you can either use one or the other. And so in this case, I don't think I will go with Invisalign, and my surgeon said go ahead. So yeah. And then are my gums going to recede or suffer? I already show you that they are very red, and no problem with them for now. I will let you know if I see any changes or so on. Are there some things that I should be more careful about after the surgery? Which side effects may I have? Pain? And so I already told you that if you have fever, bitter sweet, like bitter taste in your mouth, it can be something to worry about. But if not, apart from this, nothing to be very worried about that. And also, like, yes, about the sport and side effects, they explained me that I was gonna have ears pain for sure, and also this can last for 1 month or maybe 2 or 3. So I think it's less now. Actually, in this video it was hurting me at the beginning, but now, well, sometimes, but it's not constant, so I think it's diminishing now. I am having some headaches, but not very frequently. Low energy. Also, they told me that it's frequently that you have some cramps, like suddenly you have pain, or your even your mouth, your jaw, like moves like and I'm like what? And also you can feel like, feeling or some tingling in here, but it's completely normal because your nerves are trying to come back, but that's all what they told me. And how long should I stay in Barcelona, next to the clinic? And so basically, they told me like it would be good to be there for a week. This is, I think, is useful for you who may be living in another country or city. So as I had the first checkup the week after, normally you have a checkup a few days later or 2 weeks after. So if you can stay there for a week, I guess it's better. If not, you will come back like the second week so they can see, and a few days after the surgery. And then, can I take food complements, or it doesn't really matter? I used to have vitamins, and then I stopped when I was having all these antibiotics, painkillers, and so on. I stopped, but now I resume with the vitamins. And they told me that it was completely fine. And once the bruises disappear, can I sunbath, or until when do I have to protect myself from the sun? So this is like that. When you have bruises and you're very swollen and so on, the first week, don't go under the sun or go very protected, because if not, the scar, the bruises are gonna turn into stains, like marks on your skin forever. So be very careful with that. Now I have to be very careful with my scarf, and that they did it during the surgery. This I put some moisturizer, some creams, and so on. But I cannot go in the sun, because if not, it's gonna stay with me forever, and I don't want. And the questions I have for my surgeon for the next appointment are: when I wash my teeth, I feel like if the plates were moving, because I have kind of to hold it. I think I already told you in the last video, and I already said to my orthodontist, and she told me to not worry, because they are very, very fixed, they are very stable. So yeah, anyway, I will ask him as well. And then sometimes I have pain when I am having my mouth shut for too long. But this is slowing down now. Now I am feeling more comfortable with having my mouth shut for longer periods of time. So I think this is a matter of this being very swollen, that I still do have I still have to make a little bit of effort for this lip to go down. But they told me that naturally this lip will go down a little bit as the swelling goes down, so I will find it more comfortable to be with my mouth shut. And that was the last question. I had it written there. I hope it helped you a little bit. I think I covered about the recovery, the food, the exercise, the things I'm feeling, my concerns. So also, just letting you know that sometimes, now that I'm saying my nose, it can get a little bit wider. I feel myself that it's also not only uplifted, but a little bit wider. But my family, they don't notice that, so I don't know if it's true or not. So something for you to know that this can happen, that this is wider as well. But this is all for now. I hope it helped. I send you loads of love. Thanks for watching. If you find this useful, give me a thumb. Not for the sake of give me a thumb, but just to help me improving, or if you have any suggestion, really tell me, because this is just for you to help, and this hard. So have a good day, guys, and until the next video.